President Biden has promised to make COVID-19 vaccines available to all adults in America by May. We've heard Dr. Fauci and other science-based experts say that in order to reach herd immunity, between 70 and 90% of us would really need to be vaccinated in order to eliminate the threat of continued spread, at least at this pace. Still, a lot of people are nervous or maybe unsure about these vaccines. So I want to bring in Dr. Atul Grover with the Association of American Medical Colleges. Good morning to you.
Good morning, Sonia. Thanks for having me.
So among the most hesitant, according to the CDC, are people in rural areas, also Black and Hispanic adults, and even some healthcare workers. So what do you attribute this to?
Well, first of all, I think it's critically important to understand that the vaccines, the 3 approved under emergency use in the U.S., are incredibly safe and incredibly effective, even though it was done quickly. There's not been any shortcuts taken as far as safety or participants in clinical trials, but I think we need to do a better job of getting that information to people. And especially with healthcare workers, I think they, more than anybody else, both for public safety and for setting an example, need to understand that this vaccine is what's going to get us to the next phase of the pandemic and get us that much closer to normal.
So, Dr. Grover, maybe we can just take this opportunity now, right, to talk about these COVID vaccines. How are they developed? How do they work? And sort of explain the protection that they offer. I know that that's a complicated process, but, you know, maybe we can offer someone a little good information today.
I'm happy to give it a shot. And I think, you know, what any vaccine does basically is to try and fake your body into getting exposed to a little bit of a piece of whatever it is that we want you to develop immunity to, viruses, bacteria. But, you know, when you get a flu shot, when you get a hepatitis B shot, when you get other shots, basically what those shots do is introduce a small bit of protein that looks just like the proteins that are on a virus. And so what your body does is create antibodies. You can think about that protein as being the hand, and then your body creates a glove. That glove signals to the body that it wants to get rid of whatever that glove is around. And so what we've done with the COVID vaccines is a little different in terms of where those proteins come from, but really the same idea. You're producing little pieces of protein that are not harmful, will not give you COVID, but it's enough for the body to recognize that piece of material, create an envelope around it so that the body knows if you're exposed to the actual virus, it will attack it right away. And that's basically how all vaccines work.
I think you did a great job of explaining a very complicated process in a short, sort of condensed time frame. You know, I talked about this a lot, but you can never mention it enough. People are really worried about these side effects. I think that's what's driving some of the hesitancy. Can you explain the most common side effects and why they might actually be a good sign?
Yeah, the side effects are, again, related to that immune response that you want to see in your body, right? So when you get sick with something, when something actually gets in, a cold, flu, something else, you will start to feel feverish. You will start to feel like you're achy. You will feel tired. A lot of that is really due to the inflammation in your body that's created when it starts attacking that virus or whatever it is that's infecting you. So essentially what we're doing is simulating that infection because, as I said, you're creating this way to identify those pieces of virus that are coming in. Your body starts attacking it, and that can create a little bit of inflammation. But it's really just like a flu shot that hopefully all of us are getting annually. A little bit of redness, a little bit of soreness. Maybe you'll feel some tiredness. I certainly did after my first shot, went away after about 24 hours and was able to work through it. But all of these things are really just signs that your body is working the way it's supposed to and that the vaccine is working the way it's supposed to. And so that should really be comforting, although it'll be uncomfortable for maybe a day or so.
Yeah, and I would imagine it's also important for employers to make accommodations so that people can get vaccinated and recover if need be from some of these side effects.
Incredibly. And so, you know, for businesses out there, for all types of employers, please make time available to your employees. It will help you get your businesses on track faster, help you open up, keep those employees safe, healthy, and working. But you've got to give them time and the space both to go get the vaccine, which we know can take a couple of hours, even in the best case scenario, but then also give them a day or so, maybe more, to recover when they get that shot. That's critically important. They will thank you, and they will be much better prepared to actually do the work that you want them to do together with you.
Great advice, as always. Dr. Grover, great to see you. Thank you so much for your time today.
Good to see you. Thanks, Sonia.